Well, thank you very much. So my name is Abena Kwarteng, and this is the final presentation for the internship um, for the BSMI program. And Terrell was my mentor through this internship opportunity. And I must say there is one last community engagement that I am participating in coming up in June. And that is even outside the time period for this, but I really want that exposure. And so I'll be doing that with the team as well. And so this presentation was to, or this internship was to pretty much get to know more about Cone Health and their community involvement, as they really do have a lot of facilities in this geographical location. And so Cone Health actually is a not-for-profit health organization. It was constructed, or construction began in 1949 and doors opened to see patients in 1953. Currently, they do have 7 main campuses where they provide care in the community. And they do have a purpose to connect healthcare and well-being. And they do have a vision, which is a tradition of health and well-being, which is woven through the community fabric of the greater area. Recently, Cone Health came up with a new initiative where they do desire to move from a center of excellence to a center of significance. And so through this, they want to focus on improving health equity, to improve on quality of the healthcare they provide to the community. They do want to improve community satisfaction and engagement, as well as making healthcare accessible to all. And so through this, I really found a meaning for what I desire to do, even as a student, as I progressed through my career, where health equity is of great importance to me. And so that led me to this team. I met with the team, and they had actually realized that there is a significant increase in uncompensated care, and the financial assistance which the healthcare enterprise offered was quite cumbersome for patients to navigate through. And so through this, a result that actually brought up the need was that the ER utilization for patients had really increased. And the increase actually came from patients who were uninsured. And so primary care providers were not involved, but pretty much the ER had been used as a source of getting healthcare whenever it was needed. And so with this, the substantial increment on uncompensated care was quite significant, and how could it be improved? And so they did realize that navigating through the existing programs was just not even feasible. And if you think about it in regards for patients, comparing to even some of the employees who were there, was quite difficult to help patients walk through the process. One issue which was realized was that there was so much misinformation and misconception of the existing programs. Through this program, they do realize that patients had the opportunity to apply for Medicaid, but there was no way Medicaid and the financial assistance that the enterprise offered could work hand in hand. So you were either able to apply for Medicaid and get approved, so Medicaid takes over the payments of all care provided for you, or you will be able to get financial assistance. But you should have applied for Medicaid initially and be declined before you can actually apply for the financial assistance. Also, other departments within the enterprise do have other financial assistance, but it was a need basis, and it was usually in smaller increments, and so it was not sufficient for patients to actually embark on. And then again, it was not something that was available for all. For example, the cancer center in the hospital had a program where they used to offer assistance. And the primary care offices and other ambulatory care centers did not have anything like that, but the financial assistance that the hospital provided itself. And so with this, we did some information gathering and then had to come up with approach to hop on this on how to improve access for the financial application for patients. And so we did some information gathering through inpatients, through outpatient ambulatory care centers, and we did have some extensive information, but then we had to narrow down on the scope as to what we could do for the moment that we were in. And so the focus was determined to concentrate on the outpatient care. So it will be outpatient and then the ambulatory care settings. So we did form a team where some of the existing ambulatory care centers who had this program in place were able to share their processes with us. And then we were able to bring them on board as well. This also included the two financial navigators who were within the total enterprise to share their application experience and how they were able to offer assistance to patients. We also had to identify who the key stakeholders would be. So this involved the chief medical officer who was on board for health and equity, or who's assigned to health and equity, and also the director of health and equity access for patients in the area. We had to go through the existing program, which the hospital had, that is the financial application. Though it's quite extensive, the navigators had been able to narrow down to condense the information to patients, which will make it a short process and also impactful, where they had narrowed down to the resources that were available and then also the requirements for applying for the financial assistance. And I had the opportunity also to shadow the financial navigators and working with three patients who came through applying for financial assistance. Though there were three patients who initially applied, only two were successful in getting the financial assistance approved. That was because they did follow through each step of the way and provided every documentation that was required for them to qualify for financial assistance. The other one fell through because of a lack of availability of a notary public for some documents that needed to be notarized. But aside that, the other two were able to walk through with the process to get financial assistance. And so my mentor and I actually did meet to see what we could do to help improve this process for patients. We realized that coming up with a condensed approach where the patient can actually easily get this information to apply for financial assistance could be important. And then also to see how best the EMR users within each location are able to see information regarding the patient's progress through financial assistance applications, so patients can be informed as well. And then we also did initially think of coming up with an infographic or something that would help patients navigate through the process. Though we did hit some barriers along the way, but these were all things that we did think through. And then also improving on the EMR that we currently have to where it's easily accessible information for the EMR users to be able to guide the patients through the process. Financial assistance itself within the enterprise is quite a hefty package. When approved, the patient actually will have 6 months of coverage where all their care will be paid for within the enterprise. But then again, financial assistance could be for 100%, 50%, or about 75%, depending on what requirements you did meet. So there were approval limits within that, and the patients were made aware. And this will cover your emergency room care, your primary care visits, and also radiology testing or diagnostic testing, laboratory work, and all others. The great benefit also for this program is that when they do turn in the application, they are also able to get dental care through the Guilford County. And also they do get a pharmacy card where medications through the cone pharmacy could be as low as 4%, as $4, I'm sorry, or as much as $10, which is a great thing for patients. But then again, the application requirements can be hefty, and that was where patients fell alongside. Some of the information needed to complete a package could include your tax returns, your college student status, your disability award letter, your pay stubs for the past 90 days, a notarized letter of support, letter of Social Security benefits, proof of assets, and on and on. So it can be cumbersome for patients. And so we actually sat down and then broke up our work into different phases. The initial phase, we met with the financial navigator, as I did mention earlier, where they went through the application content and package requirements and came up with a sheet where we itemized all this for the patient, including all identification that was required. And also the navigators came up with a timeline for the completion of the packet. And sometimes they did have success in this, as this guided the patient to quickly complete the package, the packet, and to submit. Because if the packet has not been submitted and approved, patient will still be accruing debt, which will affect your credits and all that for any care they get within the enterprise. And then once approved, sometimes the counselors did give some retro package to cover some of the costs. But if a patient has no financial assistance application and approval within the system, the enterprise also offered a 58% discount to all self-pay costs that were accrued by the patient. So phase two, we also met with all the some users of the EMR, which is Epic for the hospital. So some of the users actually did walk us through what they're able to see regarding the status for patients who have applied for financial assistance. And some of them also had limitations, as they were not able to get to different screens of the EMR for security reasons. And then they also shared their experience with us regarding patients who had shared frustrations or some limitations or any hurdles or barriers they had with regards to applying for financial assistance. So in phase three, we also met with the billing department to see what the requirements were, if they were able to see patients who actually applied for and approved status of financial assistance, and how they were able to notify patients if this package was not there, and how or what assistance did the patient have when it gets to that point. Also, we had to work with the billing department regarding the EMR securities. Once we identified users who would need the security to be able to see where the patient was within the status application, so also to keep the patient informed. Once that was granted or in the works, this is where I worked most with Terrell on phase four, where we had to see how best we can make it easy for the EMR users to be able to see these award letters or application status for the patients within the EMR. So assuming a patient was in the office for a site visit and had any questions on the applications which they had already turned in, EMR users or front office navigators will be able to see the status and keep the patients informed. And so we did create a tips and tricks sheet for patients, for the EMR users to be able to walk through the EMR to see these award letters. And sometimes it was mostly just a read-only option for these EMR users, just because the billing department had sole responsibility of updating those. We also did some testing and validation after the tips and tricks sheet was created. And we also did realize that the different users had different screens. And so we had to, I believe, modify the tips and tricks sheets about twice before we were able to at least get one that would serve for all the users who did require that accessibility. Also in phase 4, Terrell did share more knowledge on how he does his work as a healthcare engineer on this field, and also what we could and could not do based on our scope for this time. And so he also offered some of the possible solutions in getting these financial award letters and all that visible for the front office users to be able to also share with the patients. And that we did get buy-in from the whole team that was working on this. And we went through the tips and tricks sheet and also was validated as being easy to navigate through by all these end users. And then at the end, also, we had to refine our desired outcomes, knowing that we wanted to come up with an infographic that would help the patient. But we did also realize that there are so many resources out there that the patients did have, but it was really an issue of navigating to where they could find these, some of which were contained on the enterprise website. And so after all this was shared with the EMR users, we also came up with information for enhancing the website for the hospital. So patients just logging in online will be able to see where they can retrieve the application and also where they can get resources from within the enterprise as to what options are there for them regarding financial assistance. Through this also, we realized that it did take a chunk of time initially in getting some of our securities granted because of conflicts in meeting times. And then also when it came to securities regarding HIPAA and all that stuff, we had to really make sure that only the real users who have a need for were granted the securities. And so that really took a chunk of time in our work. And also sometimes some of the emails and follow-ups did fall along the way, and we had to revise those and then reach out again before we were able to get answers to move forward. And then also, Terrell and I realized we had to limit our scope in some of the work that we were doing as others did fall, for other departments, and we really could not work on that. And so that did go back to the bigger team regarding recommendations for more users or more navigators and all that. That was something we really couldn't work on, but then we could recommend that the enterprise works on that. And so we did identify on the bigger team, we did identify some issues in that we realized that there are limited resources for patients regarding the financial assistance, and that was known. And then also the financial counselors and navigators, as I was working with one, did resign from the enterprise. And so within the enterprise, we currently have only one navigator for all these patients. And then also the front office or end users do not really have a great training on where to locate some of these award letters for patients. And then also even no knowledge on how to obtain this application for patients or guide the patients if they were to require on what, or ask questions on what options are there for them regarding financial assistance. Also, we really wanted to work on, or the enterprise was advised to work on the application packet to where it's really concrete and condensed for patients to easily fill through, because there were some portions of the application that were quite repetitive. And if the patient actually did provide any information that was not originally in the stated question, they could be denied for that. And so a revision of the application packet was also an issue which we raised with them. And then also looking at the application packet, it is quite cumbersome. The list I went through regarding tax information and Social Security award letters and all that are only just to name a few. There are about 21 requirements that patients will have to produce before the application is even reviewed. And a big limitation of it was, and it looks like that was the most of the denials that the enterprise had out there, was regarding tax returns. And so the navigator that, or the counselor that I actually shadowed, had been able to pull the IRS link for requesting your financial or your tax returns for previous years, and had that also included in a tips and tricks sheet for patients to follow. So with this, it was quite helpful to the patient. But then again, there could be a limitation if the patient did not have any means of using that link to retrieve or request that IRS packet. And then also, we did realize that if they did have more navigators and counselors, that could really, really improve on patients working through the process to get some assistance for care, as the system actually really wants to embark on improving health and equity across the geographical area. And then a final step, which we really actually thought would be great to work on, is a way of notifying patients of the progress. It looks like most patients would have to receive a letter notification. And if the patients had any limitations as to being out of town or not checking their mail and all that, it could be a limitation for them. And so through my chat, we did make a recommendation to see if patients can be notified through my chat, so they can know if there are any deficiencies with their financial packet, and then they will be able to meet a timeline to submit that document to avoid any denial for their application. So some of our recommendations is that, yes, there is a labor need. And so there's a recommendation for position creation. About 3 or 4 financial counselors would be great to have to help easy navigation for our patients to work through this. And then we also want to streamline the coverage areas, because it looks like the existing 2 counselors that were in the enterprise had an assigned location. And so other locations which did not have anybody assigned would not get any assistance for patients to be able to navigate through the process. And so that was also a recommendation. And then for the EMR, we did recommend some enhancements to help patients easily navigate, and if preferred, even be able to fill out this financial assistance packet through the EMR. So some information based on their information in the EMR could be transferred into the application for easy submission. And then also through the EMR, like we suggested earlier, to have a patient notification built in there, so they will get alerts that stated what deficiency they had in their application to be able to submit that. And then also on the hospital's main website, we did suggest that or recommend that the application packet be available on there for easy access, so patients are able to print it off the website and not having to make a trip into the office to pull the packet or to request for a packet, even though we realized some offices did not even have the application packets in there for patients or clinics to be able to offer to patients. And then also, lastly, we did realize that a resource guide for patients will be greatly enhanced in the process. And so if patients have a step-by-step process in this, they will be able to easily fill out the packet and submit without having any deficiencies where maybe communication may be lost and then eventually leading to their denial. And one thing we found out through this work also is that if a patient was denied the application through the application process, they could not apply again until another 6 months. And if they were actually already awarded the financial assistance, they would have to renew their application every 6 months to stay within the program. So in that 6 months, the patient's needs were assessed again. If you did have some income in there, then the award letter will have to recalculate to see if you would still get the assistance and what percentage you will be getting. And so the ongoing work is to spread the work within the community that patients actually, once these positions have been filled, are able to get a guided hand through the application process. And we are seeing that this will actually decrease the EAR use for primary care, since patients will know that they are not going to be required to make payments upfront when they do come to these clinics. And then also to notify primary care providers and engage them in signing up with some of these patients, knowing that care is going to be compensated. And then also the enterprise is looking to increase screening and mobile programs within the community. And hopefully this will create more awareness for patients as they increase their significance within the community, and also in turn decrease the utilization of the emergency rooms for regular care instead of true emergencies. And then in about 6 months, this program is going to be reassessed to see if, one, the number of navigators that were hired were sufficient enough to walk patients through this uncompensated care and the application process, or if there is a need for more navigators and or a decrease as the program will be streamlined for easy navigation. And so this was the work that we did. And coming up in June, there is going to be a community engagement on the 24th, with which I'm going to be sharing with patients some of these enhanced application process, and then also sharing some of these links to, say, the IRS, and then also some of the packets where notaries can be located within the enterprise and all that, and sharing applications with them so they are able to apply easily and improve on the limitations that have been existing within the enterprise. Thank you.